The stroke is very devastating. It happens in the middle of nowhere.
It can be so instant, suddenly your life completely changes.
The coordination is not there. They have spasticity. It's often happened to be like phenomenon called neglect. The perception that they have the body is not there. This is something I have seen, the huge gap in the rehab. I started to think, okay, my engineering skill and my kind of focus or passion can be connected to something. Dario had this amazing idea to connect the brain signal to the peripheral stimulation to promote neuroplasticity to the brain. Gradually, they started to have this movement. They get so excited, they get emotional. Sometimes they cry and cry with them as well. They sometimes say that this time of life is the bonus, let's say. They survived from a stroke. So why not they enjoy this moment of life? Even they have weakness of the muscles. It's beyond being able to move again.
Enabling people, that's the part that excites me the most. You are also a founder who spends most time with patients and their family members to understand them more.
They know the sweet spot, what should be done. Not less, not much, but in the sweet spot.
We need more healthcare providers, patients teaching us how to do better. It's a huge teamwork, isn't it?
It's very difficult to realize what you don't see.
Over-engineering is actually a really interesting topic. We actually have to stop ourselves quite frequently as well. How do you make sure that you differentiate that this is a fun engineering project as to this is something that is absolutely needed?
I've been thinking about this question quite a lot these days, actually, to be honest. Is it something that actually those populations are looking for? Or is it like my ego, engineer's ego, to fill in the camp? I believe that
Jumpei, welcome to our episode to learn more about neurotechnology. First off, can you tell me more about yourself? I actually find it really interesting how your journey went. You worked in a big corporate and now you're setting up a startup and so on. What's your passion? How did you get there?
it's going to be a long story,
yes.
but we have time today.
Yes.
So maybe starting from my childhood, I was very passionate about making things when I was like 5 years old, like my son Yuto. And I was creating a lot of things, and then also like disassembling the electronics in my home. And my mom was sometimes angry about it, though. And I continued using this mechatronics, robotics stuff during my teenagers. Came across to one university lab that is in Waseda University. And they do have a lot of robotics projects. And I was so fascinated about it. So I went to Waseda University, successfully entered the university. And then I was studying about robotics for many years. And it was a lot of fun. But more I do about robotics, the more I realize that it's so difficult to make it as to deliver to the market because it's so complex mechanisms and it costs a lot of money and effort to enter the market. So I was so fascinated about how this can be like mass produced in the cost that a patient or the customer can handle it. So that's why I was interested in the automotive industry, which is, let's say, like successful mass production industry. And then I went to Toyota Motor Corporation to kind of experience and also like immerse myself in those industry. I was there for at the end like 5 years. I was in the hybrid system engineering, and I was like working on like taking balance between driving experience and the cost and fuel consumption. I learned a lot over there, like kaizen method, principle of problem solving. But then I realized that do I want to continue creating stuff about automotive and also making cost reduced and some commodity engineering? I questioned myself for many years, and I realized like, okay, what I want to do in my career is to serve people, to help people who is in need. So I made a big decision after 5 years and then quit Toyota and then came to Imperial College London to become bioengineer. And that's my start of bioengineering. I was there for 1 year as a master's and then become a research assistant, research associate. So I was there for 6 years as a researcher in Imperial. And I've done a bunch of research like prosthetic hands, exoskeletons, and neurorehabilitation devices. And the company that I founded recently, that 1 year, 2 years ago, is about one of the inventions that we have done in the Imperial. And that's the start of my entrepreneur journey.
Thank you very much. As you said, it is a quite of a like diverse journey. I just want to cover, because lots of people think about, do I want to go into a startup or do I want to go corporate? What was the biggest difference from you going from a big corporate? And if you worked there for 5 years, it must have been such a big change. I know you just roughly kind of covered, oh yeah, I made a decision and then I took off. What kind of drove you, and what kind of thoughts did you have to go through that kind of like a huge leap? Not only just that, but you moved the country as well. So what was the motivation and what really helped you to make that decision?
I wanted to solve the problem. That's the big kind of mindset I had, I think. And of course, as a company's like employee, we can solve a bigger problem that I can do. But influence to the company was so minimal. All the decision was made from the, let's say, like upper management, corporate decision making. Of course, if I can spend like 10 years, 20 years in a company, I think I can be in that position in the future. But I couldn't wait. I think that's the main reason I have decided to leap off. And also, like, I wanted to see like more a customer or patients in front of me rather than many people, layers in between.
I know you also have quite of a special story of personal journey of the health. So do you mind sharing a little bit about why you got more passionate about patient care?
I was working as a postdoc in Imperial. It was about like 3 years after I started my job. I've got this big disease that is called lymphoma. It was stage 4. My son was only 10 months old. I had this like a chest pain in my chest in the morning, and I just like went to the A&E in the hospital, and I was there for like a week or two for the assessment. Initially, I was told that there's a possibility of 3 possibilities. One is lymphoma, one is stem cell tumor, and third is like deadly cancer. And if the third one was the case, I would need to get a chemotherapy on the next day I was admitted in hospital. It was even like scary for me to like say the word about chemotherapy, and I was crying in my bed, and I phone called my wife, and we were crying together. And I spent like 1 or 2 weeks on the assessment. Luckily, it was lymphoma that can be cured, and it was called Hodgkin's type of lymphoma, which has the very like established drug to be cured. So after that hospitalization, I've got this chemotherapy treatment for 10 months. And after the chemotherapy, I've got stem cell transplant, which I was injected a high dose of chemo and inject back my stem cell to regain back my kind of immune system. So it was a whole lot of journey. I also like experienced death even in those assessment period. So I realized that the life can end very soon, very easily, even tomorrow. But during this process, I also recognized that even if I have the small light of the hope in day-to-day basis, I can cling on it and then just believe on that tomorrow can be better than today. And that's like whole experience I have done personally as a patient, and that is driving myself to and bring something good in the world as an entrepreneur.
So I think that's really one of the story that I was kind of drawn into when we were having a discussion. And obviously one of the things that I always say, oh, if you guys need the support, I would definitely whatever it requires, because I think the people who are working in neurotechnology or like in healthcare, providing in CAM, they all have different motivation. And one of that kind of patient experience driven motivation is actually a very special thing, because you don't see them as, okay, I'm trying to support patient. You almost see them as, I could be that. And I think I mentioned to you is that one of the biggest difference for me, because I've been innovating in medical devices since like 2013, it was very much of a research and innovation and development project before my journey of my brain tumor. And I had this kind of like a turning point in a way that when I was diagnosed with my brain tumor, and then I suddenly had to take quite significant time off from my whole journey. And that journey really taught me of translation of research into actually starting a company and making a real life impact. So that's what you mentioned about the tiniest help really means so much when you're a patient. And I think this is one of the things that I'm really passionate about, is that yes, absolutely, statistic like analysis and making sure that the impact is huge and everything is absolutely really, really important. But when it comes to patient day-to-day life, the fact that you can just stand up a bit better, you can reduce dizziness a little bit. If you can just have a little bit of more time without having a headache, it's such a huge thing. And I think, you know, how we talk about the patient journey teaches us so much about what it feels to be a patient. So I'm curious to know of, do you think your journey as a patient, going through assessment, going through the near to death experience, kind of formed or changed the way that you now work in innovation?
To kind of understanding, recognizing your life can be possible to end today, that we know by like theory, but unless you experience that, you cannot understand by heart.
Yeah.
Right now, I'm working with a patient who got stroke. It's not, of course, cancer or those drug type of disease, but they actually, the stroke is very like devastating condition. It happens in the middle of nowhere, and your life gonna change completely. And that's the time you're going to be experienced, okay, my life can change whenever it can happen. And out of, let's say 100% population of the people, out of stroke survivors, about 10 to 20% going to be live to death, but remaining population going to be survived. So that's why they are called stroke survivors. And I often have a conversation with survivors that some people are like very positive in their life after they got stroke. They sometimes say that this life time of life is the bonus, let's say, because they are, let's say, supposed to die, but they survived from a stroke. So why not they enjoy this moment of life, even they have weakness of the muscles, even they cannot maybe talk that well, they have brain fog, but they have this like amazing positivity sometimes. I really get fascinated and very inspired by those people. And that's something I felt as a patient as well, because I survived from death. So if I can do whatever I can do in my second life of second chance of my life, I need to do it. And I know my life can end maybe tomorrow. So that's why I have to do it now.
Yeah, we have to live life. I think that's actually one of the attitude that I developed as well, is that living life fully. And it's not just about, oh, future, I'll be happy or something. That right now, I want to be able to support them. And I think that also kind of goes into, okay, are we going to spend the time in particular way now and then in the future? But one of the things that teaches you going through this big health journey is, no, we want to make an impact now. And it goes to one of the story, actually. I'm sure you've got lots of patient story. And there was one of the participants who really was supporting with the co-development of our technology. And they were saying that, I know it's not going to help me in my lifetime, because I know that medical devices take years and years to develop, but I hope someone benefits. And I said, you know what, Ruth, like, I want to help you right now. So I think that's another reason that I really got into a non-invasive. What can we do right now? Of course, we want prevention. Of course, we want a cure. But as innovators, what can we do right now became such an important journey for myself. And it seems like your team is also very focused on what can we do and what can we tangibly support them right now. I actually really want to also ask you about why stroke, because I know that you've got lots of experience in engineering and also the quality management and so on. I kind of feel like you also have a story of why you decided to focus on stroke. I do also wanted to ask you a little bit more, and I don't know stroke as well as other conditions, but I had a fall a couple of months ago quite badly. I lost my balance and I fell and I could literally not move for a good amount of time. I went into this like a shocked mode, and I nearly hit my head. And later on, I was actually talking with another innovator in stroke, and they were saying, Lucy, actually, that's one of the biggest reasons why people go into stroke as well. So I think often we associate stroke with, oh, it's not something that will happen to me. But actually, with these accidents, it's very much near us. So I would love to learn more about why did you decide to go to focus on stroke to support people with the survivors from stroke, and how frequently frequently, how can it actually happen?
So that's a very good question. And to answer it in short, I'm not constraining myself in the particular disease for like kind of achieve my vision. It can be like expanded to like, let's say, rare diseases or pediatrics or Parkinson's, for example, anything. I'm seeing this is going to be my starting point. It's rather more to like bottom up, I would say. So when I was working as a postdoc in Imperial, trying to like do something to innovate. With my co-founder, Patrick, we invented this very nice device that can detect and stimulate at the same time in a wearable format. And we were trying to apply this idea into limb loss or limb difference populations to go into the prosthetic market. But it was quite struggle for us because the condition of the limb difference is very like varies, depends on the population. Cost going to be so much expensive because we had to have the motors and full system inside the prosthetics. And I started to realize, is it something that actually those populations are looking for? Or is it like my ego, engineer's ego, to fill in the gap? And I started to think, okay, maybe it's my ego. I think the populations, the patients are looking for something that is easy to use, that can be hit on the table and whatever, and it can replace in the minimum cost. But I still have this kind of like passion that I want to do something with the engineering skills. So we have done a bunch of brainstormings with Patrick and my supervisor, Dario Farina. And at that time, Dario had this like amazing idea to connect the brain signal into the peripheral stimulation to promote neuroplasticity, the brain rewiring to the brain by intervening in the peripherals. And he has done this like basic lab experiment, but beautiful experiment about 15 years ago. And he has been thinking about how he can translate this idea to the market. But at that time, the equipment was like so huge, bunch of headsets, wires. It's like not compared to the translation.
That's how we started doing it.
Yeah, exactly. So we have done like brainstorming together with Patrick and Dario, and we said like, oh, this idea can be used in that idea combined together. So it's not like amazing rocket science engineering that we have done, but more to like putting things together to be able to translatable to the market that is also like easy to use, adoptable to the patients and the clinicians. That population is, or that intervention, let's say neuromechanism, can be adopted to anyone who got brain injuries. So it's not only stroke, but TBIs, traumatic brain injuries, or possibly to the spinal cord injuries patients, because neuroplasticity can happen in the spinal cord as well. Anything that is related to the motor learning, motor control, neuroplasticity, this idea can be adopted. Clinical evaluation takes long time as a medical device. So we are thinking to how we can enter the market quicker, how we can serve the people much quicker. So that's why we are thinking to use this, like using these muscle sensors to kind of support the patient's journey, how they can be more encouraged to do the exercise and be more confident on their journey. So if you see in that way, the population is not only for stroke, but expanded to like many people who is facing those challenges in day-to-day basis.
Over engineering is actually a really interesting topic that you mentioned about. You had to like think about, is this my ego or is this something that you really want? So we actually have to stop ourselves quite frequently as well, saying that are we doing an engineering project or are we doing impact-driven specification and really looking into something that people need and something how it's going to help people. How do you manage that at the moment? I mean, your team, you've got lots of engineers. Both of the founders are technical founders. So I'd love to learn more about how do you make sure that you differentiate that this is a fun engineering project as to this is something that is absolutely needed?
That's a very good question. It's very easy to fall down into like over engineering as an engineer. I tend to do that as well.
Naturally.
Naturally, because it's so exciting. But I think the experience in Toyota was teaching me a lot as a foundation. And Toyota's method is often talked as like kaizen method, but it's more than that actually. It's more than like making things better. But beyond that, what do you want to achieve is something you're gonna be thinking about, first of all, like what world do you want to achieve and what is the status right now? And between the dreamed world or ideal state of the world and the current state, the gap in between is the issue, the problem we have to solve. So every time the tortoise method is thinking about what is the gap in between, and then trying to understand why the gap is happening. Why? There's many like why techniques inside. But if you set what we want to achieve clearly, you won't be missed out what you want to go for. It can be like high like milestone or high vision you can achieve, but it can be like, let's say, middle or lower layer objective you want to achieve. I want to deliver the device that is useful, meaningful to the patients. And if you set that objective as a milestone, you will never over-engineer.
I think that's actually one of the great things. I think realizing that I do have a tendency to do this, so watching out for it is actually one way to really mitigate falling into over-engineering. And that's one of the things that I constantly try to think, okay, am I just excited because technology is quite cool? Or is this something that people absolutely need? It's like almost a practice that you always have to do. So I think it's really great that you almost kind of understood about your tendency and try to manage that. I do also have to say that you're one of the founders that I know that works the most, and I would love to actually, and then also considering your health, I always think about how do you balance things, because developing a medical device company is a huge journey. It is going to be a long time journey for you to carry on. How do you keep yourself motivated? There's lots of ups and downs, I'm sure. And what like a secret for you to always stay focused?
Yeah, I often ask this question. Yeah, I'm always thinking why I'm so dedicated. Say, maybe like, I don't know, I don't have anything else I can be more excited even more than I'm doing right now. And I have spent good enough amount of time in industry, in academic. I spent loads of trips, fun time with my family, my wife. I know what's going to happen after those kind of like fun time. And something I'm doing right now is like more fulfilling than what I do for myself. And it can, at the end, like serve to like tens of thousands of people at the end. And I see like in my handful cases, like 10 or 20, like kind of feedback from the patients. They get so excited, they get emotional. Sometimes they cry and cry with them as well. I have this kind of trust and belief that this could work to them. And if I see 10, 20 examples there, I'm pretty sure it can be expanded to tens of thousands. So if I imagine, again, the ideal state of the world, why not I achieve that as soon as possible? And I know the people are waiting for us. So I think that's the drive for me, that kind of urge to make this happen as soon as possible.
Yeah, I think long-term conditions and neurological conditions, lots of them, one of the most important thing is actually hope. And the giving a slight hope for our patients and their family members that this can support them or their condition can be reduced or can be improved. I would actually love to ask you about improvements that you've seen, some of the stories that you've heard from your users that really motivated you. You actually mentioned some of them crying. So do you mind sharing some of the stories that extra motivated you?
Yeah, so since we started as a postdoc, I was working with some stroke survivors as a pilot study, and I was doing, let's say, newborn therapy with them. We are doing a very simple exercise that is doing the wrist extension, lifting up the hand to the up. But it was so difficult sometimes for the stroke survivors because the motor coordination is not there. They have spasticity. I gave stimulation to the muscle, and the initial few days, it's of course very difficult because it was very chronic stage about like 4 or 5 years ago, 5 years after the stroke. But it took a bit of time, like 1 week or 8 days. But gradually, they started to have this movement. And that gave them a lot of hope again to recovery. And after the people got stroke, it's often happened to be like phenomenon called neglect. The perception that they have the body is not there. But having this acknowledgement on this having muscle is moving is like big reward for them. There's one story of my cohort of patients. She managed to do very good movement of the wrist movement, and that motor coordination kind of propagated to the core of muscles. She used to have a lot of shoulder elevation, but she managed to compensate those like moving and managed to do to like individual movement, and that made her like a lot of confidence on her like kind of embodiment of their limb. And she managed to cuddle her granddaughter on her lap. Of course, it was not in the force that she can kind of hold on to her, but this confidence made her to challenge that activity. That made her so satisfied, made her to cry, and that was a beautiful moment I saw. I really want to replicate this experience to as much as of the patients as possible.
It's that human story, isn't it? Yeah. It's not about moving a little better of like a few centimeters more or reduced tremor of X amount. That's what it does. That translation of now they can hug their grandchildren, now they can go see their friends more. And I think that real life story is something that is really special about neurotechnology. You've been now working in neurotechnology for how long?
So since I started prosthetic limb, it was 2019. So yeah, quite a long time.
It's been quite a long time. How do you see neurotechnology changing? Because one of the things that I feel I'm quite curious from very early on of 2010 onwards that there has been many more interest in neurotechnology. How do you feel like a future of the neurotechnology and how much of an impact that it could potentially bring?
Yeah, I think it's huge. I'm sure the people are getting more and more interested, and as more technologies are coming up. Of course, there's a lot of good science behind, or let's say like bad science, in behind. So we have to be sure what is the truth about new technology. What I really like fascinated about is same as you, like non-invasive side of the new technology, especially neuromodulation side. As a like engineer scientist, it's quite fascinating to be able to kind of access to the nervous system in the non-invasive way. If you manage to find very shallow window in the nervous system and they interact in the mechanical way, this is fascinating. Yeah. And the more we understand about this window, the more we'll be able to access it. And then the more the product going to be in the market and the more people going to be using those technologies. So I really feel like the trend is increasing. And I think the trend is going towards what we are trying to do, like non-invasive and wearable. Because if it was non-accessible to the people, it won't be used anymore. So I think definitely the trend is going towards that way.
Yeah. What do you think takes kind of academic research all the way to translation and actually getting to people's hands? So one of the things that we discussed a lot in this podcast is amount of diverse background that comes together. I'm curious about what kind of specialties do you have within your team? What kind of discussions do you have to actually bring this research all the way from the boxes that you mentioned to actually patients where they were able to hold their grandchildren?
There's many like expertise, of course, if I name it, like clinical side, engineering, regulatory, legal side, all those sorts of stuffs. But I think everything centered into the human-centered approach, like human factor engineering. Across invasive to non-invasive, I would say as well, especially the non-invasive part, also like patient focusing consumer side of the device. Definitely this is necessary. And this is something I have seen, the huge gap in the rehab. But even for the non-invasive side, the surgeons or those practitioners will be interacting with those devices. So if the device is not focused on the human factor engineering, it won't be used at the end. So of course there's like so many expertise that is necessary for the medical device, but transitioning from the academic to the real world, I think that human factor engineering is so necessary to be started from the day zero, to be honest.
Would you say that's the reason why you spend a lot of time with your patients and family members? Once again, like I think you are also a founder who spends most time with patients and their family members to understand them more. So would you say that's kind of the part of the reason why you need to make sure that we understand their routine, what they need?
Yeah, there's a term called, this is also Toyota's term, genchi genbutsu. So it means that you have to be on the site and then examine by your eyes and ears and everything, the senses. So unless you are there, unless you sense the atmosphere, you won't be able to identify what is the problem that is existing over there. You won't be able to see in the papers or videos or YouTube. So you have to be there. That's something I really prioritize, and also I enjoy a lot as well, because even though they say this is the issue, the real issue may be in the more deeper than that. The core can be more deeper. And if you make, okay, this can be the reason or the problem as a hypothesis, let's say, you can think about it in your head and then go to other patients. And then if the patient was kind of saying the same thing, but in a different way, but you can kind of relate each other. Okay, they're actually saying the same stuff. And then it comes down to, okay, this is the issue that is happening in the actual real world. And then you can come back to the engineering team, clinical team. This is the problem I found. Can you realize it? And then we're going to be working together. And then legal side going to be coming in to make sure the medical device is met. So I think the whole journey starts from, as you mentioned, Genchi Genbutsu, seeing the patients and seeing the problem in front of yourself.
It must have been quite of a journey going from academic to actually startup founder and a co-CEO with your co-founder. So do you mind kind of sharing what's the journey like for you and what are you looking forward to?
It was like amazing experience, to be honest. I always had in my mind that I want to do something bigger than me, like not necessarily become an entrepreneur, but doing something that can change the world. That's something that is happening. It was sticking on me since I was a teenager, but I was always trying to see when that can be happened. During my postdoc time, I started to think about okay, my engineering skill and my kind of focus or passion can be connected to something to make a new business. That's how kind of we started this journey. And also the time when I was a postdoc, it was very nice time to transit to the entrepreneur, because we can use that time as an incubation period to incubate this technology, going to the patients, find a problem, and then gradually fading away from the academic and then fading into the industry world. So that was a quite nice transition for us. And we spent a lot of time to write grants as a postdoc, and we managed to successfully get quite a few of them to be able to incubate the idea. And then once we are free ready, we spun out from the university, and then we are now finalized actually the phase of the equity funding.
Congratulations. I think actually that's another big journey for neurotechnology. We mentioned about how important it is for us to bring research to patient hands so that we can actually bring the impact to the world. But between that, as you mentioned, there's a lot of people involved. There's a lot of funding involved as well. So how was your journey of raising funds for the company so that you can take the company to the next stage?
So the lead investor is from Japanese university. That's actually my home university, VC, which is quite nice because I can kind of bridge in between and kind of serve the university as well, because we want to have more entrepreneur in Japan. So we met this VC about a year ago, and we had this kind of connections to warm intro, the mutual friends, and then kind of cultivated this relationship between each other. They really liked the technology behind deep science, of course, and also they liked us as a founders, like how much we are dedicated and how we want to kind of disrupt this staggering rehabilitation market. And also he appreciated everything I talk right now about myself being patient and then trying to feeling the urge of making things done as soon as possible. So we spent quite a few time to cultivate this relationship. They know each other well. We started to know themselves as well. And then, the decision was made a few months ago. We are working on those terms and everything. But we are very excited to work with this investor because they are very dedicated and they acknowledge how it takes for the medical device to enter the market, but they believe on technology as well. So I think we can do an amazing journey with them to be able to deliver something really necessary in the world.
I think it's interesting that you said that they believe in technology. I'm sure that they believe founders. I think every time that I talk with yourselves, the passion towards to how much you want to support people just shines through. And it seemed to that you have that connection with the patients, as you mentioned, of that we really want to help them as soon as possible. I think there is lots of neurotechnology researchers, founders, experts who really want to bring this neurotechnology to the patient's hands as soon as possible. What do you think is the biggest challenge that we have at the moment of translating that research into actual patient's hand?
Yeah, there's multiple factors, and not having the funding can solve that, because we have to be sure it's funded to the right person. But of course, the more project they are, the more chance we can get the good technology out of it. I've been thinking about this question quite a lot these days, actually, to be honest. And it's one of the reasons because Japan is trying to have more entrepreneurship or entrepreneurial mindset in their industry. I have to say the UK, the US, they are more advanced, and Japan is trying to follow that process. And there's a lot of government funding happening in Japan as well. But it's not solving the problem, to be honest. It has to have something more than the funding. And what I'm now having sort of, let's say, hypothesis is that we have to have someone like yourself, or maybe in the future myself, to have gone through this process from end to end, what it entails to start from the idea and then deliver to the market in a full scope. And there's a lot of services and people who can do in the fractional way. In this phase, I can focus support. In this phase, I can support. But there's like very few people who can go through the process. And I think you already imagine very well, but if you do the process once, you know what is the critical point that can be important. And then the critical point can be mitigated by using AI, for example, or having very fractional support in minimum cost, and then go the process forward. So it doesn't need to be the full extent of tens of millions of pounds to make it done. It can be much less if you know the process well. So having this person who knows the whole process is something very valuable, I think.
I have to say, I absolutely agree. And I was lucky enough to have lots of founder friends or experts in the medical device sector, or it's kind of interesting place because there is a medical device sector, but also there is a very important part of consumer devices, because it is a medical device, but also we're talking about day-to-day use. It's not just using it like for once in a month kind of things. It's a very unique position in the new sector, I have to say. I think it's still very early stage in terms of the neurotechnology as a whole. I think it was part of medical devices, but now neurotechnology is becoming its own category. So there are a few people who've done neurotechnology and actually got it to people. I mean, we are still very much understanding brain, aren't we? And I think as the technology advances and there's more connections between people, we are able to learn more about what does patient need. Can the technology support them day to day? Can we make it more convenient for them to use? Can we make it as easy as possible for them to use? Neuromodulation, there's still a lot of understanding that we have to have, but the technology enabled lots of it. And now I am seeing lots of neurotechnology society, neurotechnology department getting set up, and it is exciting times. But I think you're absolutely right. People who've done it, people who've seen it, need to come together to constantly contribute into ecosystem. And I have to say that one of the things that these communities are doing really well is bringing those people together. And I know that you recently joined Cambridge NeuroWorks as part of your next stage. How are you finding it at the moment? How do you find this ecosystem supporting your company as well?
Absolutely. Yeah, it's been an amazing journey with them. It's been already like 3 months, 2 months.
Oh, wow.
Yeah.
Time flies.
Yeah, time flies. And I was seeing you last year, of course. I was kind of like, oh, it's an amazing ecosystem if I can join. And I managed to get there. So
Congratulations.
Journey. Thank you. So what they're trying to do is really amazing. Exactly what you have mentioned, putting people together and then let them to talk each other, and then trying to bring in these ideas to make a full spectrum from the ideation to the full spectrum to the manufacturing. And they do have that capability as an institute, like manufacturing place, the hospital, amazing hospital in Cambridge, and the regulatory people support. And they do have a bunch of kind of like schemes, let's say. The one that can be like still ideation phase, but can be like amazing idea in the future, but also like more near to the product side. So having this like mix of these different aspects can be kind of stimulating each other. And sometimes this new idea phase can feed into the product side, and they can kind of help each other as well. So having like this people under the same roof is like really necessary to have. Having someone, for example, again, like you, to be present like there and then like guiding them through, okay, guys, this is the direction we have to do. We have to focus on the patients, human factor engineering. This kind of like critical point of as a lighthouse, let's say. If you manage to guide, let's say, the new generations entrepreneurs, I think the future is going to be very bright.
Yeah, I have to say I agree. It really excites me that there are more people coming to neurotechnology. One thing that really excites me of amount of diverse background the founders have. It's not about people who did engineering. It's not about people who was clinician by background. There is such a diverse background, people who's jumping into neurotechnology and then working together to support each other. And the thing that really excites me about neurotechnology and this current ecosystem that is getting developed is that it doesn't feel like it's about I need to win. It feels like we are all working together to really support the brain health that really deserves support at the moment. We talk about we age, we manage to make lots of people live longer. However, are we living well? Can people really optimize our brain to make sure there is a well-being, quality of life is there, whether it's motor conditions or non-motor conditions. And I think that's actually a really important part. Really exciting discussion. I could talk with you forever. But there's one thing that I wanted to get your perspective, especially around people with a stroke. And I think, as we very much know, one day, like it can be so instant, suddenly your life completely changes, right? It made me think. A discussion about disability came to one of our topic. And one thing that makes me really think is that what does this disability means? I think we are all very different. If the world was designed in a way that suits different capabilities, if I may say, then they don't have to be disabled. So I think this is a very interesting thing that when I was not able to walk properly because of the fall, it made me think is that if some of the things were just a little bit easier, then I don't have to limit myself in, I have to stay at home and not be able to do things. So you've seen lots of people with limited motor capabilities. What do you view and what do you think technology can also do? It doesn't have to be necessarily a device. It doesn't have to be necessarily an application. As the whole solutions, what do you think we can do to enable people who've got neurological conditions?
Yeah, I can spend hours with you. This is amazing discussion. And I have thinking about disability as well. So I really believe that disability comes from the environment, not the person. And the environment was designed by, let's say, the people who has a healthy body, and then for the healthy body to be able to maneuver around and to be interact with the world. It's designed in that way, unfortunately. And it's not because the person has different limbs or different motor capability. It's not necessarily they have to be disabled. It's because of the environment. And I was really inspired by one of the founders. He himself had spinal cord injuries. He's a wheelchair user, but he's a founder of these assistive devices that can lower the barrier of these disabilities. And he inspired me a lot. And he talked about the reason or what is disabled the people. I believe that the environment should be designed in a way that it's not should be only for the healthy bodies. But it's not from the point of view possible from the point of view of the capitalism, because it has to be in that way to make the society run through. So I think that's how the new technology comes in. We can kind of leverage the capability of the brains and motor capability for the people who got the limb losses or motor disabilities to kind of be able to lift up a bit more to be able to interact with the environment in the way that it was designed, let's say. And then that comes back to the neuromodulation side. If you manage to target this narrow window by the technology, we can kind of understand what is happening in the nervous system, and also they can stimulate and leverage the motor capabilities and also brain cognition and so on as well. That's why I get so fascinated about neurotechnology, neuromodulation especially, that we can make. It's beyond being able to move again. It's more the life that they're going to be achieving in this environment.
Absolutely. And I love that you mentioned about motor conditions, because whoever is listening to this podcast, I think the way that we see neurotechnology is the motor conditions, it's non-motor conditions, and it very much connects together. If they can move better, they will feel better, they can do more things. On the other side, if they feel better, we can actually support them reduce the motor conditions as well. So it's the combination of an area. And I think this is one of the lessons that I'm learning at the moment, where we very much focused on the motor conditions previously, but we are realizing of impact of non-motor conditions that can also influence the motor conditions. So I think that's why also we are very excited to work with the wider community to work together to come up with the solution. And I think that enabling people, that's the part that excites me the most. So I have to say that it's really insightful of what you mentioned about the environment. We need to improve this environment, and to do that we need engineers, we need more scientists, we need more healthcare providers, patients teaching us how to do better, carers like our family members who can also input a lot of things of what kind of things that we can do. So it's a huge teamwork, isn't it?
Yeah, absolutely. And we had to work as a team by patient-centered approach, as you mentioned. We had to get the feedback from the patients. It's very difficult to realize what you don't see, and that's something we have to appreciate a lot from those feedback. And I really like the way how you mentioned about giving the kind of positivity as well, because it doesn't need to be everything that is able, or the environment has to be able to be accessible for in full spectrum, because that's unrealistic, to be honest. We have to have a bunch of the money and engineering. That's too much of engineering. But once it's able to have some sort of achievement or some accessible way to interact with the environment, it can be fall down into the positive loop, let's say.
Absolutely.
And once it's a positive loop, I really believe that people will start to get more and more excited about their lives, more activity, and then it just goes automatically by itself. And this is based on my experience as well. When I was discharged from the hospital, I was in the bed for weeks, and my muscles were like this thin. I could not walk at all. And I got very hard breathe, deep hard breathe after 5 minutes walk, let's say. I had my tracker to count the step. I was cleaning on the steps every day I make. 1,000 steps today. I'm going to make 1,000 steps. Health condition was very bad. I was on the bed through the day. So I was feeling awful as well because my son was about to be 1 year old. I was doing nothing for home. But I was just cleaning on I will focus on just steps on my life every day. And today, 1,000 steps. Tomorrow, 2,000. Next day, 3,000. If I see something improving, I can be positive. Okay, I'm doing better than yesterday. And then gradually, if I have 10,000 steps in some point of time, I will be able to cuddle my son, do a bit of kitchen work as well. So it goes for very organically on your capability. At the same time, having these milestones, you can kind of cling on it to it.
You know what, that really reminds me, after my it wasn't even actually brain surgery, it was actually one of the procedures that went wrong, and I had to stay in bed for a while, and my 2 kids were very young as well. And I think this is why I can resonate so well with you as a neurotechnology founder, but also someone who's dealing with our own health. And I could not stand up, and I felt so bad I couldn't play with these 2 4-year-old kids who were running around wanting to play with mother. But I actually realized at that moment of, okay, how can I actually still play with them? And I realized that even though I was in bed, I could draw with them. So both of the kids were lying next to me, and we were drawing. I know it was not comfortable, but at least I could talk with them and then draw something for them. And that made me very, very happy. It's I could have just said, you know what, I can't play with them, I don't have energy anymore. But the fact that I was able to just find something that I can do, that was such an improvement of quality of life, isn't it? And that kind of small things is what we really want to bring for people. It's a hope, it's more things that they can do so that their quality of life is improved. So I agree with you. I think more people, whoever is listening to this, I really want them to understand that there are people like ourselves who's really, really focusing on trying to bring more neurotechnology, more understanding. What's the science behind it? How can we make this neurotechnology pathway easier for the current leaders who are preparing to get into the neurotechnology? So I think we need to work hard so that we can pave almost this direction into more innovations, more support for patients. So I actually want to do something a bit different as an ending, actually. Most of the times we were asking about what kind of advice can you give to innovators. But this time I want to actually ask something different, if that's okay, of whoever is listening to this podcast who have a neurological condition, whether it's a motor or non-motor conditions, what do you want to tell them?
Okay, what do I want to tell them? Listen to this podcast, right? Yeah, I think your input is so valuable, as we are saying, and this will like paving our way even as well, because as an entrepreneur, everything is so new to us, and we are trying to validate whether our hypothesis is true or not. And the input from the person who got these conditions is kind of like, again, our lighthouse, which direction we have to go to. So I really encourage those people who got neurological conditions to be center in this development, to be able to guide us what is the important factor we have to focus on. Yeah, I have to say, the more I see neurotechnology companies, I more realize that there's like many very passionate individuals who got the neurological conditions are actually in that team, in the center of the team, who is guiding this development. And those teams are very strong, I have to say. They know what they are doing, and they know how much they should not over-engineer, as we discussed in the initial conversation. They know the sweet spot, what should be done. Not less, not much, but in the sweet spot. And this is like very important as an early stage company, because we don't have time and money. We have to be like very effective on what value we can increase our company and then increase the company's traction. So to do the right stuff, the guidance is so needed. Those people who got neurological conditions, yeah, that's our essential as a company.
Yeah, no, I love it. It's please do engage with us. Please teach us. Please co-develop with us so that we can make sure that we can focus on right direction, develop something that is actually going to benefit patients and their carers and also the healthcare system. So working together, it's basically kind of inviting them that we're here, we're ready to listen. So please do engage with us.
Yeah.
So thank you so much for that, Jumpei. I have to say I had an incredible conversation.
Likewise.
Amazing. Thank you.
Yeah, thank you, Lucy.